Thank you so much for joining us today. Today we have Terry McCall, and she is a kidney cancer survivor. It's been what, 1 year at this point?
Yes. Yes, it has.
Okay. We had a little disconnection, but that's okay. We'll keep on going, make sure we can get this.
Okay.
So Terry, tell us the story about what led up to your cancer diagnosis. So basically, what led you up to going to a doctor and eventually getting diagnosed with kidney cancer?
Okay. It's basically a God thing. I had gotten sick in like August and October of 2022 and didn't know. The first time it wasn't too bad, and the second time I was just in excruciating pain in every joint of my body. And I was just so sick, and my husband took me to the ER. And the ER doc, after lots of testing and a CT scan, he came in my room, and the thing that I noticed first off was that he turned the TV off, and he had been wearing a mask, and he took his mask down. And he said, "I don't know why you're in here tonight. I don't know what's causing the pain, but we found a tumor in your kidney." And I remember just thinking, stunned. I'm just stunned, you know. And he said, "That's not what's causing your pain, but you need to have that looked at." And on a scale of 1 to 5, it's a 4. I mean, of importance. That's how important this is. And you need to have it looked at. And so I immediately started to cry. And my husband was with me. And he immediately said, "No, we're not going there. We're going to do this." He said, "I think God got you in the emergency room tonight to get this found." And so, true enough, that's what we've always held on to.
Awesome. So, in regards to how did you decide kind of what doctor you were going to use, especially for the surgery, and just for what was to follow?
Right. Well, the I went to see my family doctor, and the ER doc had said I needed to see an oncologist, and so I called an oncologist, and they said I needed to see a surgeon. So then I went to my family doctor, and my family doctor is the one who gave me a few names and talked about them, and then we made a decision. But we also did a lot of research. We did a lot of Googling, and that's how we decided on where we went. And the doctor that I saw was amazing, and we got such good care. And I say we because it's not just you, it's your family too.
Absolutely. So for someone who has been newly diagnosed with kidney cancer, can you do you have some suggestions of some good questions to ask the doctor?
Again, Google is your friend, but the biggest thing is make sure the sites that you look at are reputable, because you can find out a lot of misinformation out there, and you really need to look at. My go-to site when I look for anything is I begin with the Mayo Clinic, and they have
Mm-hmm.
a great site. So I really do a lot of research, and um, I do a lot of like I go on the I think it's American Kidney Association or site, and I just look at sites that have a lot of people, patients that have posted comments too, so that I can see what they're saying and what their experiences were. And that is how I made the decisions that I made. And, I still had questions that I would continue to go back and look at and ask again and again. Don't be afraid to ask your question more than once. If you're not comfortable with the answer that you got, not that it's a bad answer, you just need the reassurance of hearing that answer again and again, just to be sure that the doctor understood what you're asking and is answering your question and not what he thinks you're asking, he or she thinks you're asking.
Oh, that's absolutely great advice. Because especially when you get overwhelmed. Sometimes you ask the question and
Yes.
then the information. Yeah. So that's, I mean, excellent advice. Excellent advice. If you could give one piece of advice to somebody who has been newly diagnosed with kidney cancer, what would it be? One piece of advice.
Stay positive.
Mhm.
I mean, you're going to have times when you're scared, you're going to have a meltdown, you're going to have a breakdown. That's understandable, but don't give in to fear. Stay positive. And my family was just like, we're going to stay positive until somebody tells us not to. And even then we may not listen.
And so, what would be one, for my final question, what would be one piece of encouragement that you would give to somebody who's newly diagnosed with kidney cancer?
You're not alone. First of all, God is with you. He is always with you. He is not surprised by this. He has a plan for you. He will be with you every step of the way. And another aspect of you not being alone is that there are people out there who have had this experience, who are going through this, who are a great resource for you to tap into. And prayer and just continuing to look to God for your comfort, for wisdom, and your family to help, to give them, like I said, it's not, I consider my answers, we did this, we did that. Your family is in this fight with you, and they need to be informed, and they need to be right there with you, but they also need to know and see, when they see that you are relying on God and that you're reaching out to God and asking God for the wisdom and the comfort, that's a witness to not only your family, but to the staff and the doctors.
Absolutely. Well, thank you so much, Terry. Thank you so much for those who watched, and I hope this blessed you. And if you know somebody who has been newly diagnosed with kidney cancer, please share this video. And the hope is that we just continue to encourage and bless people, as well as help maybe, just answer some questions for newly diagnosed people. Thank you so much again, Terry.
Thank you for asking me, Natalie. I really am, it's a privilege to do this.